chairperson of the task force. Would you open us this evening?
Sure. So thank you all for coming. So my name is Laura Delpred. I am the AVP of Community Health Action's Food Pantry, and I'm the newly appointed chair here at the Staten Island Hunger Task Force. So I do want to welcome everyone to our 10th annual Legislative Breakfast Now dinner. And this year has been one of many challenges, as you all know, as this pandemic has stretched out before us. The Staten Island Hunger Task Force has been supporting food efforts and need on Staten Island for over 10 years. And we have come together, soup kitchens, pop-up pantries, mobile pantries, and storefronts to feed our community. This year, our focus will be in supporting smaller pantries as they reopen, and also a training calendar to strengthen our internal operations. We appreciate everyone being here this evening, and we do really appreciate Congresswoman Nicole you coming in and being patient as we get our Zooms all together, because it's the new way of life. But thank you so much for being here. We can just jump right into things just to be mindful of everyone's time.
Thank you. Welcome everyone to this table talk roundtable, welcoming our new congressional representative, Nicole Malliotakis. With her this evening that will be sharing their perspectives and priorities, legislative priorities, are Nick Buess from the Food Bank from New York City, Emilio Tavarez from Hunger Free America, and Jerome Nathaniel from City Harvest, all policy wonks and doing great work both on the national level and here in the state and city level. So we welcome you all, and we turn this over to you with great joy and great welcome and great honor, Congresswoman Nicole Malliotakis.
Well, thank you for continuing this tradition, and of course, we all wish we could be here in person. I very much look forward to working with all of you. Many of you I've already have a pre-existing relationship during my time in the Assembly. Obviously, right now, food insecurity is a major issue, and there are more families that are unfortunately struggling at this time. During the pandemic, I was happy to work with some of the local pantries to do food drives. We coordinated with the local Kiwanis Club to make sure that we could support some of our local pantries who were unfortunately running very low on food. And then also, many of you know, I did my Goya food drive over the summer, which we collected about 3,000 different items. And we donated those items to our local food pantries as well. And that was very much a great initiative. But I think some of the other things that we've noticed out and about in the community, we work with Catholic Charities to deliver a lot of groceries to senior citizens. They in particular are struggling right now because they don't have the senior centers where they get a lot of their socialization. They're very isolated, and many of them were afraid during the course of this pandemic to go out and get their own groceries because they are the most vulnerable. And so we did what we could to try to help Catholic Charities distribute some of those bags. My staff had gone to and packed the bags and delivered the bags. And if you know of any other senior residences that we can be helpful in doing the same, it's an ongoing thing that we've been doing since the summer, and we're happy to support other residences as well. I think from my perspective, I want to continue the work we've been doing in partnering with the food pantries, doing the food drives where we see that there's a specific need where particular pantries are low. And then on the but obviously this is stuff that just can't be done through charity alone. It does need government support. In terms of the charitable initiatives, we know that a lot of our nonprofits are just hurting right now. They're struggling. They haven't been able to do their annual events. And so that is why government must step in and assist where we can. First of all, let me say with our young people and our students, I've been pushing to get schools reopened. For our young people need the services that are provided in our schools, whether it be mental health support, whether it be nutritional support, health services is one of the things that we need to work collectively to try to bring our children back to school. And I've been pushing that. New York State, you may or may not know, received $4 billion specifically for reopening our schools. And we haven't done that just yet. We've been pushing. We've got the elementary schools open. We do have the middle schools open, and hopefully we're going to be able to see the high schools open too. But I know that there's additional funds that are expected to go to the state for school reopening, and I urge that to happen as quickly as possible. Other programs that have had bipartisan support over the last several months has been SNAP benefits, increasing the SNAP benefits by 15%. We anticipate that will be extended with this new relief package. And we also think that there will be additional money that will be used for the WIC program, which is specifically for our women and children. And so those are two of the things that will work directly with the SNAP. New York State is going to be receiving probably upwards of close to $50 billion. And, my position on this has been, of course, I want my state to receive money and my city to receive money. I want to make sure that the money is being used properly, that it actually gets to the people. So we're in that process now. I will continue to voice my concerns about it. But I do believe that there are some good things happening. And there are some things that I don't agree with what may be in this final package. One of the other programs, which I think is interesting, that could help both our restaurants and the people who work in our restaurants, as well as the community that is in need of food, is a program that they're looking to implement, which would have some of this food coming from small restaurants with food. Instead of having the food be wasted, they can provide food for those individuals in the community who are in need. And at the same time, it supports the small and medium-sized restaurants who are currently struggling right now. So if that's a partnership that could be put together, it would be fantastic. I think it's similar to the farm to table program that President Trump implemented about a year or so ago. And I think that this could be a good continuation of that. It does have bipartisan support. And I think that that's one way we can help our small businesses and those who are in need. So, there's a couple of things happening in the works right now. I'll continue to do what we can do to give direct support and provide volunteers and support, do these drives and support our pantries as needed. And so please reach out to my office. We're working on a lot of other issues too. I know this is specific about nutrition, but people who need vaccinations, we've been helpful in trying to get people some last minute appointments. We don't want these vaccine doses to be wasted. And if the appointments are not scheduled and they received more, let's say vaccinations they anticipated, now they're short on appointments, there's sometimes opportunities to get individuals last minute appointments. For the veterans community, we were able to get the VA clinic to be able to provide the vaccinations at both the hospital in Brooklyn and the clinics on Staten Island. So if you know of veterans, please let them know that this is an option. So they are separated from the general population and can, they're dealing specifically with veterans right now at the VA clinic. So that's a good option as well. And just to keep us informed of any other way that we could be of assistance going forward in the future. And so I just want to give an opportunity for people to raise specific concerns that I should be aware of as I go forward in this process.
Hi, everyone.
Hi.
Linda, I'm not sure if you're going to jump in. This is Nick Buess at the Food Bank for New York City. I can go ahead and jump in, but I don't want to take away anyone else's spotlight.
Go ahead, Nick.
Your Congresswoman.
Okay. Thank you. First, I have to say thank you so much, Congressmember, for joining us and for laying out some of the areas that you're prioritizing. My name is Nick Buess. I'm from the Food Bank for New York City. So we are a membership organization similar to City Harvest and as well as Hunger Free America, who are joining us today to talk about legislative priorities. And we represent hundreds of community-based organizations that are serving at food pantries and soup kitchens, and often providing many other types of social services for community members who are in need because of the pandemic, but also Even before the pandemic, we knew that over 1 million New York City residents alone were food insecure. So to put some of this in scale or in perspective of scale, my organization alone has served 82 million meals since the start of the pandemic. That's million meals. That's a 60% increase from where we were the year before the pandemic. So we know that need has exploded. And I think that if you talk to the community organizations that are in your district and throughout Staten Island, you'll hear similar stories that need is really skyrocketed, and we're seeing really a doubling of people who are food insecure. And it's not surprising, right? Unemployment rate is 3 times what it was before the pandemic started. We see that 14% of Staten Islanders now are food insecure. And the resources that you talked about are essential. You know, I think the stimulus package that is being negotiated currently continues to be the most important opportunity to make sure that SNAP benefits are available, as well as many other programs that provide nutrition to low-income households. So the Federal Nutrition Assistance Program that goes to food banks, we call TFAP, it's the Emergency Food Assistance Program. It's really the foundation of food for food banks all across the country, and provides a consistent, nutritious source of food for food pantries that are serving people. Many people who also rely on SNAP benefits. When we look at the numbers that SNAP provides, it's normally about $1.50 per meal. We know that on Staten Island, a meal costs over $3, $3.75 actually. So that SNAP benefit is essential, but that's exactly why we need to see an additional increase as the economic fallout of the pandemic continues to hurt people who have lost work and who have lost wages. So SNAP, TFAP, there are other programs that you mentioned, WIC. Pandemic EBT is also a really important program for households who are food insecure. This is a replacement benefit for families who have students in public school who have lost meals, who have not been able to receive meals in public school. So this is a grocery benefit to allow those families to purchase food for their household in the grocery store, similar to SNAP benefits. There's so many other areas that impact low-income people that are potential opportunities in the next stimulus package. The way that tax incentives, tax refunds are structured for families with children, the child tax credit and the earned income tax credit. These are great opportunities to really focus resources on people who are low income. And really, I think that should be the priority of Congress is to focusing those resources to benefit people who are hurting most.
Yeah, and that's one of the points that I've been making is that we want to make sure that the money that we're giving to New York actually trickles down to the actual people who need the relief, right? And I've been saying this across the board. Look at the MTA, it got $8 billion. They're going to get probably another $8 billion, and yet they raised a toll. So that's not acceptable to me. Same thing here. If we're going to be giving the governor and the mayor upwards of $50 billion, we need to make sure that that money is actually going to get to the people who need it, which means, helping, dealing with property taxes, which addresses the issue for homeowners and renters who the property taxes ought to passed on to, dealing with tolling so people can get to their work. All of that has to be part of, I think, this discussion. And that's something that I intend to be, vocal on, not just this coming week, but going forward. And I think it's important that we want to make sure that this is tailored so the people who actually need the money get it. It doesn't get lost in some type of bureaucracy somewhere.
Great, and thank you again for joining us for this call. I think just to add to that point, my name is Emilio Tavarez. I'm the Advocacy Director for Hunger Free America. We're a national organization dedicated to ending hunger through better use of federal programs. And so I think, one of the best ways to target aid to people is by increasing the SNAP program, because there's really a robust process for people to apply. There's very low fraud, so there's no issues with that. And just to give you some examples, we know that in December, SNAP benefits in New York City were about $310 million, which would equal $3.7 billion over a year. So that's money directly going to people's hands. But not only that, it's also going to small businesses. This is direct economic aid to people that they can use in the local economy. It helps save jobs. It just moves the economic output throughout the system. And similarly, the WIC program, Women, Infants, and Children program, has an estimated savings of $2.48 for every dollar spent in WIC. It just reduces medical costs, educational costs, productivity costs. There's a lot of we're paying more for the healthcare impacts of low income issues and homelessness than the program itself. Like the program would help prevent a lot of costs down the line. And I think, for us, the main message is really that charities can't and really shouldn't be expected to solve this issue. So I really appreciate what you're saying, that the emergency food system is really doing everything that they can, and we really need to strengthen those programs. But in general, these are the WIC program and SNAP are like the main solutions that we think would really end hunger and reduce hunger substantially, in addition to a lot of the other provisions of the COVID relief package. Raising wages in general will reduce hunger and poverty. So I would love to answer more questions about those things if possible. One other thing I would love to mention is just that what we're doing now, right now, is preparing a short training, short in the sense of like a couple of hours as opposed to like 4 or 5, on just the basic eligibility criteria for SNAP around income, immigration, and household size. And I would love to do that for your constituent services staff, because as trusted messengers, they are in a good position to give the right information to the right people. Yeah. And so just making that offer to you or anybody else.
Yeah, can you
who would be
do me a
interested.
favor and type your contact information,
Absolutely.
messenger, and then JD, are you there? JD, I have 2 people from my team. I have my chief of staff, Alex Bolton, and I also have JD, who is my legislative assistant, who's dealing particularly with this issue. And JD, if you can touch base with him, and just so you can get those talking points and we can look through them.
Yes,
and share them with the district staff.
Amelia, just so you know, JD's email is actually in the chat.
I did see it. I copied that as well.
So that sounds like something very cool, not just for JD and myself, but also something for our district staff. We deal with a lot of constituents. I've dealt with probably 15, 20 of them on the phone today. Which if you do call our office, you get a real person, so that's kind of cool. But we try and navigate people through all these issues. So if you can give us some perspective, that would be really appreciated. And we're always looking to help people more efficiently. So yeah.
And we do get people with various issues. We get single mothers, we get senior citizens, we get people with disabilities, we've been taking a lot of immigration cases. So yes, the resources that you have where we can help direct or work with you to resolve some of these issues, please let us know that you're there and what you can offer, so we can put it all together. Because we thankfully have a great staff, and they're very dedicated, and we've been able to solve a lot of these cases. But sometimes we need an alternative option if something doesn't work out. So
yeah, we're happy to be a resource. And just the last point I wanted to make sure I made about SNAP is it's also it's a matter of choice. When someone goes to a food pantry or soup kitchen, they really get what's available. They don't really get a choice of what they're eating, and often the food is not culturally relevant, appropriate, or they may have health needs that prevent them from eating that food. Whereas with SNAP, they can buy whatever food it makes sense for them, whether they're seniors and they have specific diets or whatever the case may be. So I look forward to following up with your staff, and you'll be hearing from me for sure.
Appreciate, thank you.
So much. And I'm looking forward to speaking with you after this as well. Just as a reminder, the Congresswoman is going to have to hop off here pretty quickly in a little bit, so that she can make her call after this. So I am going to remain on the line. Sorry.
We're going to go really quick to Jerome Nathaniel from City Harvest, our other policy person.
Yeah, thanks so much, Congresswoman, for spending this time with us and zipping from meeting to meeting in this new virtual reality. My name is Jerome Nathaniel. I'm the Director of Policy and Government Relations at City Harvest, which is one of New York's oldest food rescue operations. We've been operating since 1982. And at the time, I'm really going to echo a lot of the things that my colleagues Emilio from Hunger Free and Nick brought up at a food bank for New York City. And then that's that we have made a Herculean response to the COVID-19 recession, as we're calling it, by increasing the amount of food that we distribute from 64 million pounds to over 144 million pounds by the end of this June. So it's been a tremendous increase. And even as we're trying to respond to that need and increasing the pounds that we distribute in Staten Island, one of our largest distributions in Staten Island is at the Stapleton houses, actually, we know that we can't do it alone. We know that for every meal that we're able to provide, SNAP provides access to 9, and it also gives people the agency to be able to work on their own time, look for work, as opposed to being constrained to the time or the space of where a food bank is or a food pantry is. So we really recognize the importance of SNAP in that solution. And one thing that I do want to add to what was already shared, because I think they did a great job outlining our priorities, those 15% increases, pandemic EBT being huge because a lot of families that aren't eligible for SNAP, which has a very low income eligibility threshold. PEBT says, well, if you have a child that's eligible for free or reduced price meals, they shouldn't be denied a meal because schools are being disrupted right now. So it's providing access to all children, even if their parent are just a little bit over that 150% federal poverty level, which is a very low bar for SNAP eligibility. But what I do want to add to their point is that we know that this is going to take a while to recover from. A lot of these relief packages are temporary in nature, and we understand that. But we also recognize that it's important to also be thinking about the future. We know that the Farm Bill is going to be up soon, 2022. So it's really important to look at some of the things that were effective this year and some of those things that may have been temporary, like PEBT or these increases to SNAP, or the executive order to look at shifting from the thrifty food plan, which is the lowest amount of benefits you can receive to live a healthy lifestyle in our country, shifting that to really reflect the cost of food. And that's some of the opportunities that might be ahead when we think about the long term when it's time to the Farm Bill. And one last thing that I wanted to bring up, because I know you brought up the point about working with restaurants. I think New York City has some great models and pilots that they started last year that the country can follow and lift. The Restaurant Revitalization Program is a program that we partnered with City Hall on, and we were rescuing food from a number of restaurants that also receives grants to pay their staff and also to raise wages for their staff. So that's really something.
And that's coming from the city, the grants?
Yes, exactly.
Yes, send me, please, please do me a favor and send JD a link to that program so we can look at it more. It sounds very similar to what we're trying to do on the federal level.
Definitely.
And I'm going to stay on the call. The Congresswoman is about to hop off, but I'm going to stay on the call, and I'd love to keep talking with you guys about the needs that you guys are experiencing as well.
Yeah, Terry, so I have 3 other members that I'm doing something with, I don't know, a live broadcast or something, I don't know. But does anyone have any additional, anything that they want to tell me specifically? Because I'm hearing you loud and clear. The
Final
SNAP,
words.
the SNAP, the WIC, and the restaurant program. It seems we're all on the same page on those 3 issues.
As
Terry?
well, it's part of the Farm Bill, so it's something for you to.
Yeah, the Farm Bill is, I'm sorry, Terry, you're cutting in and out.
Yeah. Just those issues. We're going to be in Washington the first week of March.
Oh, great.
With the FRAC, which is the Food Resource Action Conference. And maybe we'll be able to connect with your staff down there at that time.
Yeah.
One issue that I was asked to raise is that all of your food pantry and soup kitchen people are all volunteers. Many of the volunteers are senior citizens. Many of them are in vulnerable medical categories. And we lost 60% of our volunteer force with COVID because of those issues. People need to stay home. They need to protect themselves. We got it. And there's no program that actually pays the resource of people to actually get the food out. Like, I'm always driving the truck. I brought the truck because I don't have anybody else to drive a truck to take food to different locations. And that's an issue. If you want emergency food to be sustainable, there's a real infrastructure need that has never been addressed, and COVID points out that weakness to us.
Okay, Terry, I'm happy to
There's a
talk
real
about
need
this.
for that.
I'm happy to talk more about this with you. I mean, maybe we could even help you recruit volunteers until you can find a more permanent solution. But let me, why don't you have my number? So why don't we talk offline about this, and we can see what there's a way we can help, even promoting that there's volunteer opportunities. There are people that are bored too. They're stuck in their house and they want something to do. So maybe this is a good way to help them get out and do something productive and help their fellow neighbor. So let's talk about that. I look forward to seeing you in March. We'll continue the conversation. And look, whether I support the final version of this bill or not, there's still going to be a lot of things in there that I'm going to be advocating for. So, I just want you to know that regardless of how I end up voting at the end of the day on the final package, because I'm not comfortable with a lot of other things, you do have my commitment on the importance of SNAP and WIC and on this food restaurant program. And I do want to talk to you further about when you come down in March of how we can help going forward. Okay. All right. Thank you, everyone.
Excellent.
Thank you.
We want to say thank you. And I don't know if we can applaud on how this works, but I hope you can hear that. Thank you very much for your time this evening.
I see it all.
Call on us if you need us. And we're just gonna continue our discussion. We're gonna stay at the table. Thank you, Congresswoman Nicole.
Thank you. Take care. Bye-bye.
Bye-bye. Okay, staying at the table. We got a few more minutes. We have someone in the chat. I'm gonna, where are my chat here?
All right, sorry, I'm copy and pasting everything from the chat into a Word document because I have made this mistake before where I finish the Zoom and then the chat goes away. So I'm making sure that I get everything down so that we can follow up with everything that's being sent in there.
Thank you. Mike Schnall, you're on chat. Do you wanna speak? Can you unmute yourself?
Hi, I put in something in the chat. I'm running for city council. I wanted to hear if some folks had some ideas of what was being done well by the current council member, what can be done better, or what's not being done at all that could be done by the next member, whether it's me or any of the other candidates.
I wouldn't mind jumping in here. Yeah, sure. My name is Emilio Tavarez again, Hunger Free America.
Okay, folks.
Yeah, I think there's a delay with Terry.
Yeah. Go ahead.
Okay, great. Yeah, I think in general, like I was saying to the Congresswoman, I think legislators in general could do a lot more to promote some of the programs that we're talking about, like SNAP and WIC. I've seen a lot of legislators in Constituent Services Office kind of start doing food distributions, which again, I'm not gonna oppose, but I think, in general, layering food distributions with SNAP outreach and things like that is the best way to get people involved because they're already coming to that place for a food assistance. And as trusted messengers, I think every city council member should be doing more messaging around the program, dispelling, stigma, providing the right information about eligibility. So I would offer the same, training that I mentioned earlier. And then also just for Heide about something I want to highlight was something that I saw in the chat around the COVID-19 vaccine for emergency food workers. I think that not only extends to emergency food, but also just nonprofits in general. Many social service providers are, doing, digital technical assistance for people trying to apply. That's how HRA is operating right now, helping people apply for SNAP and other programs. So I think, nonprofit providers should definitely be included in, in the list of eligibility for the vaccine as soon as possible so that we can start in-person activities, sooner. I think that's a lot of what's holding us back these days, is like we want in-person outreach activities, and our volunteers want to get back to what they were doing previously, but until the vaccine is available to us, it's not safe. So I just wanted to make that point as well.
Definitely, definitely. And
Thank you.
for highlighting that point.
Nick, you want to round out with any additional points?
Yeah, I mean, I hear my question, but to make it kind of relevant, I think to JD and Alex and the Congresswoman, I think there's a bigger idea here that Emilio is talking about, which is really busting through barriers of access for benefits, because these benefits really are for people who receive them. They're survival benefits. So we don't have the time to have people wait online any more than people are already doing. If you've ever applied for benefits, and I think the country is experiencing this in a way that we haven't experienced before, is that it is difficult to access resources, and you can't retroactively eat. We know that people who were waiting for unemployment benefits eventually were receiving unemployment benefits, which is of course essential and important. It doesn't work that way with food. So there are lots of opportunities at the city, state, and federal level to really make program outreach better and fund that program outreach that's happening at community-based organizations, as well as the administration, easing the administration, the access, and the eligibility. And I think it's worth saying here that New York should be celebrated in leading some of those efforts. So we recently made it a lot easier for seniors to apply and recertify for SNAP benefits. That was a long fought battle by advocates who have been pushing for that. I think we should celebrate that as we're doing outreach to seniors to make sure that they're accessing benefits. We should celebrate as New Yorkers that we are doing this thing where we are providing service to each other. And I think that it's something we should celebrate at the city, state, and federal level, are our successes.
That's awesome. Honestly, everything that you guys have been saying has just been super inspiring, and I can't thank you enough for everything that you do to make the world and your community a better place. Like the Congresswoman said, we're here to be a resource for you guys, and this very much hits close to home, and anything that we can do, I'm not even slightly joking when I say it, please don't hesitate to email us, specifically me, since I oversee this policy issue, so that I can bring it to the Congresswoman's attention, and so we can partner together.
Wonderful. Jerome, you want to respond to Mike's question about what could happen at the city level that is not that our council can take part in?
Yeah, sure. I'll add a little more with the caveat that I'm not from Staten Island, so I think that y'all bring a unique perspective to what might be needed in your community. But overall, on the citywide level, I do think, echoing some of the things that Nick and Emilio said, we really should be making it easier for people to access their benefits so that it's a lot more streamlined. So if someone is applying for or going through the process for one benefit through Access HRA, that it's more seamless for that information to be transposed over and looked through for SNAP eligibility, for instance, and that people aren't waiting a long time and going back and forth to get their documents and for the phone interview to be confirmed. I'm sure many of us may have helped a senior or a grandparent or even yourself try to go through the process, and there's a lot of back and forth. So that's something that we definitely need to make better, and we need to Nick's point, celebrate some of the progress we've made. In addition to seniors, we're also working to make it easier for low income and moderate income college students to be able to enroll into the SNAP program as well by counting some of the hours that they're spending on some of the more technical programs as the work requirements. And we think that we can go further, and we show that we could go further by making all low and moderate income college students eligible for SNAP, because they are essentially working when they're in school and working towards making our economy stronger.
Thank you. Any
Um,
wrap-up remarks from our roundtable? Anything
No,
we
it's
should be working on?
No, it's Neshama from
Oh,
JCC. I put my comments in the chat. So the first thing, it has to do with supporting staffing, volunteer coordination, and building infrastructure for food pantries, because it's not, I don't want to say that it's easy to get food dollars, but I think a lot of, you know, there's a lot of money that goes into food, but not a lot of money that goes into infrastructure to support it. You know, a lot of people are boots on the ground helping out, and it would be lovely to have, volunteer events and recognition and, supporting the volunteers and trucks to get people to where they need to go, instead of having people wait on lines, at one centralized location, things like that. And then the other piece is prioritizing, like the food pantry volunteers as essential workers.
Could I ask a question? I'm not sure who directly to answer this, but has there been a push within the community, like to the mayor's office or even to the governor's office, about prioritizing food pantry volunteers for vaccinations, and what has the response been so far?
so I'd be willing to just take a stab at that. Actually, food pantry volunteer workers are considered under grocery workers. So you actually do qualify under a 1B category if you bring a letter from the organization in which you are volunteer. So we've gotten all of our pantry and all of our soup kitchen volunteers vaccinated to fatality with a letter from Project
I'm sorry,
Hospitality, identifying.
I should have clarified my comment. They can get it. There's nowhere to get it.
Yeah.
Gotcha.
Well, that's another problem. Yeah, that's huge.
I would add, I think some of this also points to the struggle that, like me and Emilio and Nick are facing, is that we've been getting a lot of mixed information about eligibility for vaccinations, and at least where we are right now, we've been given communication that we aren't eligible, food pantry workers and volunteers, and we've been having a long back and forth since December on the state side of things. We've just sent in a petition with over 4,000 food bank, food pantry volunteers and staff from across New York State through the Feeding New York State Coalition, requesting eligibility. And unfortunately, we're at a gridlock right now because we haven't been explicitly given that green light. But from what I hear from Terry, and what at some point we also heard from our counterparts in upstate, it sounds like there's a little bit of mixed information in terms of that eligibility. So that's something that we're still trying to get clear on ourselves, but we're still advocating for eligibility as we speak.
Definitely. And I can tell you on our level too, it's like a constant battle with the information, not just on who's qualifying, but vaccination sites. I know that we, last week, especially with the rollout of the Federal Retail Pharmacy Partnership Program, they did open a lot of new vaccination locations in Staten Island and Southern Brooklyn. But it was kind of like one of those things that it wasn't even really announced what locations were going to be there until the day that they were opening. And I know that part of that strategy was that they were trying to make sure that the vaccinations didn't all get booked all at one time. But from what I have heard, we were supposed to be getting a Empire Outlets mass vaccination site from the city in Staten Island this week. I believe it was supposed to actually be open today, but because of inclement weather, they ended up not opening it and they've delayed it. But I'll have to look back at it. But I do totally agree that not just is this a problem that is being experienced by your organizations, but it seems that throughout the city there's this lack of vaccinations, and that's something that the Congresswoman is strongly advocating for, and we're definitely putting pressure on the state and the mayoral level. But we recently spoke to the mayor's office, and they were saying that they were not getting a higher allotment from the state. So that's and from the federal government. So that's something that we were thinking of perhaps writing a letter to the president asking for more vaccinations for New York City, because I think anybody in the country could definitely say that New York City's been hit the hardest out of most places in the country. And the work that organizations such as the ones that you guys are involved with are really what's carrying kind of the weight for the community and being those supporters and providers. But it shouldn't be something that you guys get left out on with the vaccinations, especially because, kind of like the Congresswoman was saying, it is so sad that a lot of the major events that you guys get to hold each year for fundraising or for recruiting volunteers, like that really can't happen in person anymore. And I think that this is something that is being kind of, swept under, or people are just going over, and it's not something that should be treated that way. And so I know she's very passionate about volunteering, and that's definitely something that I know that we are very interested in working together with you guys on.
And just to add another thing on the vaccine, I think what's been disheartening too is just a push for opening restaurants and prioritizing restaurant workers over the emergency food system, because we really are the folks feeding people right now. So I think that shows a lack, just like misguided priorities almost in New York State,
Yeah, I can definitely see that. And that's another thing that I'm going to bring up to the Congresswoman. I did not realize that you guys were qualified as grocery employees, and that, I'm going to definitely have to look more into that. And I'd love to, like I said, follow up with you guys on how you think the best way we can be an asset for you in this is, because this is something that definitely is catching our attention, and I'm grateful that you guys are highlighting it for us, because this is something that we definitely want to help you guys out with as much as we can.
Keep in mind, the Hunger Task Force is here to help. We're made up of soup kitchens and pantries and mobiles. So if you or the Congresswoman want to come in to one of the partners on this call, or in the, that are part of the Hunger Task Force, let us know. We can show you what our day-to-day looks like. At the peak of the pandemic, we were previously seeing on a busy day 80 to 100 people. And at the height of the pandemic, we were seeing over 500 in a 4-hour period with 4 staff people. And now when we see 250, we're like, oh, that's way easier, but that's still 250, way more than we've seen previously. So if you or the Congresswoman ever want to come into any of the partners here, please feel comfortable in reaching out to us and letting us, know that, and we can make that happen.
Thank you so much. I really appreciate that. And I'm certainly going to take you up on that. I do see one message in the chat from Wendy asking if we have a list of local pharmacies receiving the vaccination by zip code. So that's a little bit where it gets tricky for us because they have been changing so much. Like, I know that the work that we did the most with last week was the federal retail pharmacy program, pharmacies that were rolling out their vaccination program last week in the district. And we met with all of their legislative representatives. And it seems that it's even a problem that they're experiencing, where it's hard to predict what's going to have a vaccine and what's not, because some are running out. And that is something that I'm going to have to look more into specifically, because I know the last that I checked with one of their representatives, they were saying that their list was changing so much throughout because they had an Excel sheet with all of New York City, and that it was changing so much that if she were to email me, in the morning, that the list could change by the night. And so what we've been using has been the NYC Vaccine Finder to really do it by zip code. But I will, sorry, I just saw another message. I'm going to have to look more into that, because I honestly, I can't make any promises. I don't think that we're going to have one specifically that says everything, because they have been changing so much lately, and I'm sorry about that.
We have a few more minutes. The floor is open for anyone who's a part. We've got about 30 people on the Zoom right now. Anybody else want to ask a question?
I mean, I guess.
Wow.
One of the things I'm just wondering, if nobody else has a question, JD, I don't know if you could speak to the concerns the Congresswoman has about the COVID relief package, if there's things that we could just like provide more information, or if you could just, I don't know if you could provide some insight there.
I definitely, so the issue, I guess, one of them would be that there is not a final text that's been proposed. So right now it's just a proposed bill from the administration, but there is no bill text. It hasn't been formally introduced in the House. So because of that, we don't specifically know exactly what amendments are going to be on there or what provisions. We kind of just have like these pieces, like broad statements, but no like really substance. So it's hard to say yes or no completely without actually having the bill text. I have been seeing reports that they're starting to move along and that we should be getting bill text sometime soon. I can't really speak on what the main concerns are because we haven't seen the bill text yet. But if that's something that, you know, once it does come out, if you guys want to set up another meeting, we're definitely open to that. I just don't want to give any misleading information because the text isn't out yet. And you never know really what could be on there or what could be taken away too through the debate process. So that's kind of, I guess, why she might have said that.
Any final comments from Nick or Jerome?
You know, I think folks have mentioned this, but and I'm not sure, JD, if you've worked with the community organizations that are on this call or part of the task force, but I think at the end of the day, we can talk about the statistics and the numbers and the dollars, and they matter. Don't get me wrong, but you know, I think that there's an opportunity for the Congresswoman to continue to appeal to the hearts and minds of people in Staten Island, in her district, about the significance of how community organizations meet the need and how that need needs support from the federal government. You know, folks are talking about providing stipends to volunteers, or I know a lot of agencies need to provide Metro cards to even have volunteers come and do the work of really the service that we entrust volunteers to do on behalf of the government in a lot of ways. The Federal Nutrition Assistance Program, TFAP, is a federal program, and we rely on volunteers in part to do that distribution. So the aid to localities that the stimulus package could include is also an opportunity, as well as pointing to New York State's examples of smaller relative to the federal government, but investments in local community-based organizations in doing that work as examples. So, you know, I think there's a lot of stories and anecdotes that can be powerful in communication about these issues. So I would encourage you to continue to be in communication with all the groups that are part of the task force to elevate that and to really tell the on the ground stories.
Definitely.